The Beach FM Business Lunch Show, brought to you by PlaceMakers Kapiti Horowhenua. Together we're building New Zealand.
Welcome back to the Business Lunch Show on Beach FM 106.3, and let's talk personal hygiene now. Let's talk to somebody that deals with the area that was the problem area over the last couple of months. Let's talk to a dentist. Let's talk to Alana Mitchell from Beachside Dental Surgery. G'day, Alana.
Hi, how you going, Damian?
I'm very well. How are you doing at this time?
I'm pretty good, thank you. Yeah, pretty good.
Hey, it's an interesting time, mate, and you deal with the area that we all had to stay away from. So how are you holding up after COVID? Well, now we're in level 1.
Yeah, pretty good. Pretty happy to be in level 1. It was a pretty stressful time over the level 4, level 3 period, but glad that we've all sort of done the right thing and stayed at home and got rid of COVID, hopefully.
Fingers crossed, touch wood, all that stuff. Hey, what we like to do on the show, first and foremost, Alana, is just to get to know the people that we're talking about, to. So how did you start out? Where did the dentistry, how did it start for you, and how did it lead you to Beachside Dental Surgery?
Yeah, okay. Well, I guess dentistry was something I always wanted to get into. I was always quite interested in it, particularly the practical side of it and being able to help people. That really appealed to me. And after studying down in Dunedin, sort of got some experience and decided that I wanted to be my own business owner and ended up on the Kapiti Coast. So that was in 2010. And since then we've grown our business and we are what we are now.
Excellent. There was a stint at Hutt Hospital, if I believe, as well, wasn't there?
I did. That was my first year out. I worked at the Hutt Hospital and that was amazing. Just learnt so much there. Great first job to start in. So much support and having all the specialists around you, learnt heaps. That was, fantastic. You
would have seen a few things being on call on that in that early stage of your career?
Absolutely. There's some very interesting things. And it was quite an eye-opener as a new graduate, getting thrown in the deep end, I guess. But knowing you had the support there, and it was really good. Yeah, being exposed to things that you wouldn't normally be exposed to in private practice, yeah.
Brilliant. So it did lead you, that path led you to your own business. How did that come about?
To be honest, after I left the Hut, I worked in private practice in Australia and really loved it, loved my boss, loved my job, but wanted to come back to New Zealand, and so I did, and didn't have quite the same experience and probably didn't enjoy my job that I had back here as much as I thought I would, and that sort of prompted me to sort of look into having my own business and being my own boss and doing the things the way I wanted to do it. And so the opportunity came up to buy a little practice up here on the coast, and it was too good to turn down. So that's where it happened.
Brilliant. Yeah. Well, we've talked to a number of people over the last 8 weeks that have loved what they're doing, but not so much working for the man. So what were some of those early learnings? I mean, you've a decade behind you as a dentist or in the profession, but now you're a new business owner. So what were some of those early learnings taking over your own practice?
Yeah, so I knew nothing about running a business when I took it over. So I learnt a lot pretty quick, and I'm still learning now, 10 years later. But I guess from day one, patient focus has really been at the front of everything I do, and I think that sort of shows where we are now. We just really want to have the best experience for our patients and do the right thing by them, and do the best job that we can while keeping everyone comfortable.
Well, the first thing you see on your website is dentistry is our profession, people are our focus. Good mantra.
That's right. Yeah.
Excellent. So, so you got your own business in the Kapiti Coast the last 10 years. You're doing well. Then this little pandemic comes along that affects people with their sneezing, their throat, the area that you deal with. So what were those early Because I imagine to some degree you'd be an essential service as well, but we're got to stay away from people and their germs. So how were those early steps of COVID?
Oh, well, look, leading up to the lockdown, things were starting to get a bit stressful for us. Even just trying to get our basic stock of masks and gloves and just day-to-day PPE that we have to wear was getting harder and harder to source, and the prices were going up and up and up. And, everyone else was trying to get all the stuff as well. So it was getting really hard for us because we pretty much can't practice without masks and gloves and just the basic stuff. And then when the lockdown sort of happened and we were told we were essential services, but to be able to provide that service, we needed even more protective gear that was just not available for us to get our hands on in the beginning, which was really difficult because we were told, we couldn't send toothaches to the hospitals, or we didn't really have a direction of where to send anyone, or have the gear to see people ourselves, which was really tricky because toothaches a pretty painful thing and it's hard to get away from with just pain relief. So sort of towards level 3 we did manage to get hold of some PPE and help quite a few people, and level 2 got even easier, and now we're almost back to normal, but we've still got a few extra things that we do just to keep everyone and ourselves safe. So
of course, your safety first and foremost as well. I mean, what did you have to do? What have you had to put in place, because you can't exactly do your job 2 meters away from each other?
Yeah, no, social distancing doesn't really work here. At the moment, what we're doing is we're getting our patients to have a sort of a pre-rinse of Savicol, sort of an antibacterial, just to sort of eliminate any bacteria in the mouth at the time, and then anything that we're doing, which is most things, that create aerosols like drilling and spraying air and water. We are trying to isolate the teeth we're working on with a rubber dam and using a high volume suction, and just protective eyewear and masks and that sort of thing. Yeah.
Brilliant.
Yeah.
So let's get down to your knowledge now and expertise and passing it on. Why is the mouth an afterthought for some people? Why do we not look after our teeth better?
Oh, I really don't know, to be honest. It's just not a high priority for some people, which is it's quite disappointing. And I do think it's possibly because people obviously think dentistry is expensive, and it is expensive, and it's an expensive business to run as well. But I think the expense is when you start getting to the pain. So if you come to the dentist might tell you need a filling, but, people aren't getting any pain from it, so they might just leave it and not sort of, worry about it. But it's when it starts getting painful that the options start getting quite expensive. And I think I don't know, people just, some people do obviously value their oral health and want to keep their teeth, and other people have different priorities. But, I think investing in a checkup and a clean once or twice a year can really, put off a lot of those big jobs.
Oh, absolutely. Like a tune-up. Yeah. Like a tune-up.
Yeah. That's right.
Does this kind of thing, the rotten tooth, the toothache, whatever, can that lead to other things? Headaches? Can that lead to mood swings? Because I know in my past experience, I did have one that went a bit pear-shaped, and it changed my life once I got rid of it. So is that an actual thing?
Oh, yeah. Yeah, look, it's like if you've got a toothache or an infection from a tooth, it's like having an infection anywhere in your body. You run down, your body's constantly trying to fight it. And, people can have these infections in their teeth or their mouth for months and months and not get it sorted because it's not actually hurting or it's draining out. But it is. It's like your body's constantly fighting it, and that can, affect your mood and you feel run down and tired and not quite yourself. And a lot of people do, after they've had a tooth out or had something fixed, they say, I didn't realise what I was putting up with before, before having it fixed. So, yeah.
Oh, that was me, definitely. And lastly, can a smile change someone's day?
Absolutely. And I find, absolutely. Definitely. That's one thing that I do enjoy about this job is I feel like I can do some for me, pretty minor things for people, but it's quite life-changing for them. And seeing people smile after we do something that I think is quite minimal, it's a really good feeling. It's really cool, giving people a lot of confidence and seeing them, flash their teeth, and yeah, it's great.
Absolutely. Now, last thing I want to touch on is that you did do something different during the lockdown, and you did supply the local community food pantry with a lot of toothbrush and toothpaste. Small thing, but it is one of those things that that smile can literally change how someone looks in the mirror at themselves, how they're perceived with other people. So awesome stuff.
Yeah, thank you. I'm glad everyone. I didn't realise how crazy everyone was going to go for those toothbrushes. I'll have to go restock them again.
Brilliant.
Yeah.
Well, Alana, thank you so much for your time. But lastly, as we always ask people on the show, where can people find you? How can they get in touch?
Yeah, we're on Kapiti Road, 331 Kapiti Road, Beachside Dental Surgery, and our number's 298-6004. And if you've got a toothache, just let the girls know and they'll get you in straight away.
Awesome. Alana Mitchell, thank you so much for your time today. Go well, my friend.
Thank you so much, Damian. Thanks for that.